Did you know just 30 minutes of walking can reduce your risk of heart disease by 35%? And yet, most people still struggle to just move daily. Why is that? Because they think movement has to be intense to be effective. But in fact, according to the American Heart Association, moderate movement like walking or yoga can actually reduce stress, improve circulation, and even extend lifespan. Hello, welcome if you're new to my channel. My name is Dr. Erica Steele. I'm a board certified naturopathic doctor. I hold 7 degrees in my field. They're all in the natural healthcare space. I like to say that I went to school so you don't have to. This week, welcome to week 7 of Intro to Holistic Medicine. And we're really focusing on movement as medicine. So this week, I'll show you how to incorporate movement of longevity, balance, metabolic health without exhausting yourself. So we're going to get into structures for fulfillment. So today, we're going to discuss, also too, if you still haven't registered for the class and you would like to join, it is a self-paced course. You're more than welcome. We'll scoop you up at the end. And so go ahead and click the link in the bio and register, and away we go. Reach out if you have any challenges. So without further ado, the topics that we're going to be covering, really why low impact is essential for our recovery. And so one of the reasons why we use low impact movement really is for, again, if you've been really working hard throughout the week. Also, too, if you've got stuck, sluggish lymphatic drainage system or circulatory system, or even if your nervous system has been dysregulated. The best types of low impact naturally are walking, because that's our natural state, yoga, tai chi, which is movement with breath, rebounding, which is also, you can use that with a device, the old school kind of rebounders back and forth, but they also have vibration plates, which are really helpful too. Qigong, which is also another kind of movement with breath, and stretching, just traditional stretching. And so as you're beginning to move your body, it supports your joint health, naturally circulation, lymph flow, stress reduction, especially again, movement with breath. I really encourage, even if you're walking, make sure that you're breathing and you're being mindful of your breath. And naturally, it's going to help your mobility. I cannot tell you my years in family practice and seeing the difference between patients that really worked on their mobility, especially with their legs, and versus patients that didn't. And when we would assess their lean muscle mass in their legs, we could see deterioration even as early as 35 or 40. And so I know we don't necessarily think, I would be a fall risk at 35 and 40. But rest assured, if you are not toning and working on these muscles, they will just atrophy and go away. So please maintain. We want to make sure that you provide yourself enough, movement, strength, that sort of thing. We want to build up to about 10,000 steps per day. Now, you may not have enough muscular activation for any strength gains yet because you've atrophied, you haven't been working out in a while, you're not moving your body. So really take it easy. This is just about getting blood flow in and moving your body, not necessarily, breaking any awards or anything. Some of the things you want to be mindful of is we want to do this in therapeutic order. So making sure you have adequate amounts of water. So with your water, you want to make sure you're at half your body weight. So about a half ounce to an ounce per pound of body weight is kind of around where you need to be. And then working towards your protein. So your protein needs to be about 0.6 to 0.8. So about a gram per pound of body weight. And that's so that you have enough amino acids for muscle maintenance and tissue repair. Your carbohydrates, which you're going to get for that slow burning energy for sustained movement, you want to make sure your complex carbohydrates, which are your fruits and your vegetables, which is where you're getting a lot of your fiber and your energy from, is about 40 to 50% of your food. And then your fats, your healthy fats, mind you, your avocados, your nut seeds, is about 20 to 25% of that intake for joint lubrication as well as your hormonal balance. Your heart rate, if you're checking that, needs to be about 40 to 60% of your maximum heart rate, which is ideal for your active recovery. Again, making sure you're drinking plenty of of water. So water, protein, those two things have to be in place for you to begin exercise. If you just start exercising, don't have your water, don't have your protein, you are putting yourself at risk. Another thing to think about is your electrolytes, making sure you're maintaining your potassium, your magnesium levels for muscle function. So if you find yourself, let's see, like restless leg, or, your legs are bothering you, or you're having any palpitations, definitely check your magnesium and your potassium levels. So I would recommend, if you are on the couch doing nothing, to try a 15-minute low impact movement session a day, either walking, stretching, Tai Chi. You can look on YouTube something and just go ahead and see what it feels like. And definitely let me know in the comments how you feel. If you want to join into Intro to Holistic Medicine and really learn how to transform your health, or you want to deep dive into one of our wellness collectives coming up, which are going to be our exclusive health programs to educate you and your family to live naturally, just let me know. All the links are below in the bio, and like, share, subscribe for more.